Hello everyone, I am Dr. Renee and welcome to my channel. I am back today to talk about side effects of chemotherapy. In my last video, I mentioned that Landon received chemotherapy during the pre-transplant period and the fact that there are risks with a bone marrow transplant. In this video, I will talk about some of the risks of the bone marrow transplant, including short-term and long-term side effects. So, what are the potential side effects of chemotherapy? There is a long list of possible side effects when receiving chemo, but in this video, I will mention only some of the more common side effects. There will also be a list on the screen while I'm talking, just for you to have some visuals and some idea of what that looks like. So Landon received reduced intensity chemotherapy, which is basically low dose chemotherapy. And this type of chemotherapy lessens potential side effects. So what does that mean? Well, there is a reduced intensity chemotherapy, and then there's this standard chemotherapy. With the standard chemotherapy, this is high dose chemotherapy, which essentially wipes out all of the blood cells in the bone marrow, as opposed to reduced intensity chemotherapy that where it doesn't wipe out all of the blood cells in the bone marrow. So the point that I'm making here is the standard chemotherapy regimen is way more toxic to the body and can lead to a lot more complications. And so for that reason, the low dose chemotherapy, or what's called reduced intensity chemotherapy, is the favored option. So my husband and I gave consent for Landon to be a part of a research study that looks at how effective reduced intensity chemotherapy protocol is compared to the standard high dose chemotherapy. So this study will gather information from the patients like Landon when consent is obtained from either the patient or their guardian to be a part of the study. The information they gather from the bone marrow transplant from each person will be helpful in showing how effective the reduced intensity chemotherapy is in curing sickle cell disease while decreasing the potential side effects. So let's take a look at some of the common short-term side effects of chemotherapy. It's a long list, but we're only going to focus on some of the more common ones. So the more common side effects include hair loss, anemia, bleeding, also mouth sores and ulcers. People can get infection due to a weakened immune system. And a lot of people will experience fatigue and also have, some people will develop diarrhea, as well as organ damage. So the doctors prescribe medications to help to decrease the side effects and make it more tolerable. I mentioned in the second video that Landon had a severe reaction to one of the chemotherapy drugs. And for him, it was the first chemotherapy drug that he had a severe reaction to. The first dose was a small dose, and he tolerated that dose fine without any big issues. But the second day, as he was receiving the second dose, he developed a significant reaction during the IV infusion, and he dropped his blood pressure as well as his oxygen levels, and he also developed a really fast heart rate, which we call tachycardia. That's the medical term for a rapid heart rate. He did get most of the chemotherapy at that point when he developed a reaction, and so of course they stopped the reaction and treated him with medications to lessen the reaction. So the next day, when he was due for his third dose of chemotherapy, the transplant team made some changes in the dose and extended the IV infusion over a longer time frame to try to prevent another reaction. So for example, they say that they were giving it for 2 hours. They then extended it to 4 hours to see if he would be able to tolerate it better. He did make it through most of the third dose of the chemotherapy, thank God. But he did have some trouble breathing during the process, as well as he did have a drop in his oxygen levels again, and a rash, which was mostly on his extremities. But once they stopped the medication and treated him, thankfully the reaction did improve. But on this particular day, his symptoms were a lot worse. Specifically, the side effects, right, from the chemo was a lot worse than the previous day. And so he was of course, evaluated by the transplant team as well as the ICU team immediately when he developed a reaction. And of course, they were all involved in his care just to make sure that he didn't require closer monitoring in the intensive care unit. So thankfully, his reaction improved, and he did not need to be moved to the ICU. So he did end up staying. He remained on the transplant unit without any big events after that. So so at this point, he had one more dose of that chemotherapy left to get, and at this point, we my husband and I wanted to kind of regroup with the transplant team. Of course, they wanted to discuss with us, give us more information to help guide us, to help us to be informed and to be able to make the best decision we could about whether or not to continue with this last dose. So in Landon's case, this chemotherapy was very important to the success of the transplant. And so after a lot of consideration and prayer, my husband and I felt that Landon had a good chance of making it through most of the last dose based on the transplant team's plan to adjust the dose, as well as to spread the infusion of the chemotherapy out even longer. So again, they changed the time frame so that instead of him getting it over, say, a 2-hour period, it was changed to, say, 5 hours. I can't remember the approximate amount, but it was somewhere within that 4 to 5 hour window. So thankfully, he did make it through most of the last dose of that particular chemotherapy. And so that was his first admission, which I talked about in the previous video. And so when he returned for his second admission, which was about a week later, he did receive 2 additional chemotherapy drugs, but he didn't have any big issues with the other 2. So the important takeaway here is that this is all very serious, and it is really important to ask questions, to be informed every step of the way, to be able to, for you to be able to make decisions for yourself or your loved one. Sometimes people might get a reaction that is, not commonly seen in Landon's case, like in Landon's case. So it's also important to be prepared for the unexpected in this process and discuss your options with your doctor. So now that I talked about some of the potential risks of chemotherapy, let's take a look at other potential complications from a bone marrow transplant. One of the major risks of bone marrow transplant is severe infections. And this is due to the fact that the immune system is severely weakened. And so the immune system, which is essentially your body's defense system, right, it's unable to fight infections, which of course leads to a much higher risk of getting life-threatening infections. And so the doctors prescribe medications to try to prevent these infections. And some of the medications include an antibiotic, an antiviral, and an antifungal agent to prevent severe infections. But it's important to also keep in mind that even when this is done and every single precaution is taken, some people still develop severe infections, and some people can, obviously, this is a pretty high risk procedure. People die from them. So it was a blessing to have Landon make it through without having any serious, or severe infections. Um, Another possible complication is organ damage. And this could be any organ in the body, literally any organ. This could be the liver, kidneys, heart, or the lungs. And in the case of people with sickle cell disease, we already know that with sickle cell disease, they have progressive organ damage. And so the younger patients that undergo a bone marrow transplant have better outcomes because they tend to have less organ damage compared to adults who have cumulative organ damage over many years. One of the benefits to bone marrow transplant, when it is successful, is that it will prevent further organ damage in the case of sickle cell patients. Other complications that I think is really important to talk about are graft rejection and graft versus host disease. I also think that it's important to kind of give an overview of the possible complication of infertility. This is one of the complications that a lot of people are really concerned about, not being able to have children, or their child not being able to have children. And so I think that these particular complications deserve their own video. So I will talk about that in the next video, as well as testicular preservation, which my husband and I consented to for Landon. So I also want you to keep in mind that all the information provided on my channel in any format is for information purposes only and is not to be a substitute for professional medical advice, diagnosis, or treatment. The information I share is not meant to diagnose or treat any medical condition, so always consult your physician or a qualified health professional with any questions regarding a medical condition. Never replace medical advice given to you by your doctor or a qualified health professional, or delay seeking medical advice or treatment because of something you've read, watched in a video, or saw in any format on my channel. And of course, the pictures and diagrams that you've seen in the video, they do not belong to me, and I don't have any rights to them. So I just wanted to kind of, have you guys keep that in mind. So that's all I have for today. And if you like this video, please press the like button and subscribe to my channel to get, an alert about my weekly posts. And I thank you for watching, and I'll see you next time.